Shobana, thank you so much for being here. And I want to start with just a very obvious question. How would you assess this present moment in India and the pandemic? What is your assessment of where we are?
Hi, Payal. Thank you. And good evening to everybody here. Not such a great subject to start a weekend with, right? Everyone wants to break out the alcohol and drown some of those. But today we actually have the dubious distinction of recording the most number of cases in the world. And I think that really tells you where we are. We might have started on the pandemic late. And believe me, I'm a big believer in, even though I spend so much of my time within the economy in CII and all that, but I do believe that that early lockdown definitely gave the health system time to prepare. We knew there was a tsunami coming. We knew this thing was going to overwhelm us, but to be able to have some amount of medicine, actually the protocols that countries have finished it, so there was enough science to be able to help us prepare. But having said that, I think that no matter what we tried to do with lockdowns and this thing, as soon as you started opening out just a little bit, and I do remember that a month or two ago, we said the strategy would be open up a little, lockdown again. So that kind of strategy, it's crazy. There's nothing like that. We're just in it. It has burned, it has overwhelmed many cities. But now we're seeing it actually go down into the entire population. And I don't think we've seen the worst of it yet, because you're not getting figures. Today, the highest in the world that has been recorded as a population is Andhra Pradesh. And what happens when the most populous states of India, of Bihar and UP, actually, it hits within the hinterland. So if you ask me, where are we? I think we could still be pretty much at the early middle.
That's, well, like I said, this is a truth-telling session, not an optimism-giving session. So I'd like to know more, but I just also want to contextualize the question with, at these scales of populations, right, of physical, geographical proximities, of lack of space, of people crammed into homes that just are too many, and so on, is this even a tackleable problem?
Of course. Come on, look at the great cities and the pandemics that hit them in London and all that. So I think what you have to see, and after giving you so much doom, let me give you a bit of optimism. The best cities were built after that. So if we learn and create a wonderful new Mumbai that is not crowded anymore, I think that is progress. So I do say that that the problem has to be tackleable, and the way that they did it in Mumbai, that you ring fenced Dharavi, that that the way that tracing, tracking, creating new facilities, this is all there. But I don't think the pandemic is a problem of the cities that have healthcare established. I think the pandemic is more what we're seeing now. I live in Hyderabad, and I'm seeing our hospitals in Chennai and in Hyderabad, in Vizag. We're getting cases from the hinterland.
Sure. So what
it's everybody's problem. It's everybody's problem.
What, according to you, will it take that we have not given it so far, societally, as governments and as individuals? What will it take to get a grip on where we are?
So the best countries that you see that have actually managed it have actually behaved with some discipline. And I know, because I asked a doctor the other day about, my son was traveling. So I said, can I send this Flavivir or Azithrol or any of these vitamin C, zinc and all that? And I know that a lot of you are sympathetic with what I'm saying with this. I even said, how about remdesivir? And he said, this is all ridiculous. because this is, these are not solutions. What you have to do is to keep the discipline of what they said earlier, that hand washing, the cleanliness, the masking. All this is the only way for us to stop, that contact from taking place. So I think that discipline, if you ask me, and it's it doesn't even sound nice as a nice solution, I should have given you a sexy solution saying that, take this medicine or do this. I can't, because in truth, there is nothing. We're using repurposed medicines. So till there's a vaccine available, I do think that discipline is actually the need of the hour.
And I wanted to take off. I want to take off from what you're saying, which is to say, so when you're speaking of it now moving out into the hinterlands from the urban areas, even if discipline exists at different degrees, I think there is some sense in the urban areas for two reasons. One, just more access to information, early access to information, the benefits of education, the benefits of resources, all of that lead us to be able to make those choices. But in the hinterlands, is it even in your sense, and because Apollo is present everywhere, have people even been able to communicate and grasp the essential nature of these very simple interventions? Do you think the message has adequately gone out to those parts of the country that none of us see on a daily basis?
Payal, I think so, because the government has done a phenomenal job in information dissemination. Every single channel, everybody did it. There is, probably just a baby that doesn't have the cognitive. Anyone with any cognitive ability in India knows what what this COVID is about. Trust me. The only thing is the way that, this is, so if it was a world war, then you'd find the bombs, you'd find the thing, the action and everything going on. This is like a silent killer. It's going to come into your house. It's going to come into your neighborhood, your workplace, and you won't know. You can't see it up front. It is a gun, but you can't see it. So that's the thing. Why in those areas they say, my livelihood is more important. I have to go. I have to do this. So I think it's about that. It's about choices.
Is there now, unfortunately, that the economic reality, and a lot has been said and done already about the challenge of either closing an economy and saving lives or losing them with that. Where are you placed? You've, as the president of the CII, you have, and as running this as a massive healthcare business, you are on both sides of this question. You're on the health side of the question and on the economy side of the question. What do you think is there an answer to this conundrum? Have we taken the right path in what we've chosen?
I think that we've been quite responsible, and I really can't give I can't generalize, but I can tell you about Apollo. So we have a business that was largely empty, the hospitals, for a long time, for several months, because people were really scared. And then we said, once the lockdown lifted, so what we did is make sure there were ample precautions to make it a safe environment. So I think that same thing, workplace, factories, all these ample, you take extra care to make sure that it's a safe environment, and you open up intelligently, but you must open up. Keeping things closed is not going to save lives. There are going to be more lives lost, as already 15 million people gone into poverty, so many jobs that have gone away, that are not coming forever, middle class jobs. So I think that there is a rational answer, that you continue to be cautious, you continue to be careful, and more than anything else, you use the best prevention for the most vulnerable.
So in the next few months, is there, you said in your estimation, we're at the early to middle. Do you have a broad sense of about when this might hit a peak at which we start the downward curve? Do you have a broad sense of what those numbers might look like? Is there any modeling or thing that you have access to?
So we were studying several world models. and also the statistics in India. Every day I get the report. Our own hospitals, kind of do this modeling. And we at one point estimated so that, using that R naught, I think we're beyond the R naught factor of 1%, how many people they would infect. We're beyond that. It's just gone into the community. This is widely spread. So now we're looking at where burnout would be. And I think that we have to look at two things, that the cities that have gone into it, you're seeing Tamil Nadu, just look at it for the next couple of weeks. I think that if we can keep it, we're looking at a plateau. So there are going to be cities that will start plateauing. And then there'll be other districts that will start going up. And so I'm not sure that we can think about a downward now till there's a definitive vaccine which is around the corner. And I think when that happens, we will start seeing a downward. But the good thing is that people that are getting infected, there are a lot more that are actually getting well. So I would think that that's the important factor for us to see. What is our death per population?
Is what do you attribute? I'll come to the vaccine because it's a slightly longer conversation. But what do you attribute our lower death rate? Is it also to do with, to that extent, the demographic, so to speak, dividend of a younger population? To what do you attribute that? And do you think that is there any reason to believe that that will not stay the case, a lower death rate than many parts of the world?
To the large extent, you're right that there's a younger population that is getting sick. We don't have the rate of obesity that is there in other countries, but we do have a lot of diabetes and the vulnerable. So I think that if you look at it, what you said is the broad brush answer, but I would not discount the fact that India provides medicine and healthcare at a much, much cheaper rate than any place in the world. Just the cost of remdesivir, it was like 5,000 rupees a dose. You take 5 of them and it's worked really well when you can catch it early. And hospitals that do that, you're seeing that the mortality and actually the outcomes are way better. So I would give the healthcare system a bit of credit in this. And also the fact that the pharma industry has really stepped up, that we can do this at a good price and at an affordable price, even though we're discontinuously. Those are those odd cases that are really, really sick. I mean, they're tough. But by and large, if you average it out, I think that the cost of corona care in India is definitely the lowest in the world.
You spoke of, and I just want to talk of testing. And as recently as 2 or 3 days ago, there's a piece by Atul Gawande in the New Yorker talking about America's problem, not a resource problem, not a technology problem, but an implementation problem when it comes to testing, right? And he goes, what do you think vis-a-vis our testing strategies? I know that there's no uniform answer because there's also not one strategy around the country. What do you think is, for this stage, the right protocol going forward for the next few weeks or months vis-a-vis testing? Who should be tested? How frequently? What type of tests? Is there some sense of that?
I think that by and large, whatever that we're doing, that we've ramped up huge numbers from when we started the journey, that there are more kits available. I sit on the board of a Geneva Foundation that is only for diagnostics. There are new tests that are coming out, which are just $2. The earlier ones were expensive. So you have to think there's an economic, if the test is going to cost me 4,000, would I really want to take that test? But if the same test, if it's going to cost me 1,000, then I will take it. There'll be more and more people that the government will give it to. So I think testing is great because not only are you seeing where it's hitting, but so you can prevent a few, the R naught, but what testing also does is catches it early. And that's really important to me because God forbid if I or anybody that I knew got it, we want to catch it early because we do think that the outcomes are so much better. So testing early has to continue. And I don't think testing will go away ever. So this is going to be something that we're going to need forever and ever, that COVID test is going to be mainstream.
So to come now to the vaccine, which is literally pretty much for most people the only hope. That's you will look at it. And
sorry, Payal, sorry, I didn't answer that question. So there's some of us that are going overboard with testing. So I do think, and the doctor, our infectious disease doctor, once really laughed at me because I went out and then I said, oh my God, I live with my mother-in-law, I need to test. I can't go near her. So I think there needs to be a more balanced, nuanced approach. And I know that Apollo has put out these protocols in the recent past that I've actually read. So I think that don't waste countries' resources over testing.
So actually, but since you did, that's actually a good lead into a simple question. When would you advise most of us, given our circumstances, we're in urban centers, and I think everybody attending has some means of distancing, definitely access to masks, to all kinds of whatever. When would you advocate we get ourselves tested, if at all?
Symptoms. Everybody knows those symptoms. In fact, in the early days when it just started, 4 days after it started, we released a testing app. We were the first one that did that test. 15 million people took it. So I know that now 15 million people are actually educated. They know the symptoms. They know how to do it. We even have a cough scan in there. So I think that the digital apps that are helping you, I would advocate going through that first because it gives you a probability. So look at that. It'll give you some early symptoms. And then I think you do the responsible thing that if you have any of these issues, then definitely test. And if you think that you've been exposed for more than 10 minutes, I do think that you have to isolate yourself and then test after about 3 days, 4 days. If you test the next day, it's not going to help.
Sure. So, like I said, to come to the vaccine itself, how hopeful are you about, of course, there's news that the Russian vaccine, counter to all imagination, may also be producing some positive results. There's, of course, the Oxford vaccine. To you, what is a reasonable timeline in which this vaccine goes from being a reality to actually starting to have an impact? At what stage, what scales, what timeline can we say, this vaccine now means something rather than ticking the box that we do have a vaccine?
Okay. So you asked me 3 questions in this one. So the first is about Russian. And I wouldn't really diss the Russians because they did have awesome technology. The LASIK surgery, the eye, the Russians had it much before anybody else in the world. So they do have cutting edge. It's just that, the way that they do it is kind of, it's not well documented. So that's very important. Which brings me to the second one, that documentation to me would be the most important when it comes to this fantastic world effort, where it takes normally between 5 to 15 years to find a vaccine, that this collaborative world approach that has brought it in less than a year. I want to know and whether it's safe. So effective is next. But first thing is this safe? If I take it, will anything, spookier happen to me? Let's get that out of the way. And I think that that's what the phase 3 trials will prove, that it is safe. And then I heard, about the vaccine itself. The early vaccines that are coming out now, the AstraZeneca and the Moderna and some of these others, the Bharat Biotech, all these, I think many of them, that these vaccines will serve, should do about 60% protection. But if you really want the ultimate of the RNA, the DNA RNA kind of vaccines, it's going to be till June. Okay. So the last part of that question would be that what would be safe, how to do it. And I would think that the most vulnerable, for sure, take this, even if it's as long, you do, even let's not sacrifice good for the perfect. So give them the vaccine early, the healthcare workers, the vulnerable, the who have comorbidities. Let's get that done with and make sure whatever vaccine we get, as long as it's safe. Now, the last question you asked is, how long will it take, right? So how long? You know that it took us decades to eradicate polio. It took us 5.5 years with 35,000 stations to get Aadhaar cards for the 1.5 billion Indians. It took 5.5 years. The first lot, of course, we finished in a wave. Having said that, the government is, we want to think that 1 billion people, if 300 million won't need it and all that. Even 1 billion, think of the challenge. And the good thing is, India provides 60% of the world's vaccine. 60%. So Serum Institute, 1.2 billion. The others that Biological Events, My City, tied up with J&J and many of the others. So we'll have some amount of capacity, provided that they're going to sell it to many parts of the world. India has not, we have not advanced booked. We're taking it for granted that because the vaccines are here, we get first dibs on it. But if you ask Aadhaar and Poonawalla and all of them, they'll say, hey, US and all have actually paid me money. That money is in the bank. Those guys have blocked out supplies, EU, all these people. So I think we need to get that strategy in place of how many doses they are, one. Two, who will be, they already know who will be the first ones. So how do we get it out? So I would think that we're looking at almost a year before this, end of 21 is a best case scenario. That if we start giving it on a war footing by end of November or December, it would take at least a year to cover just the vulnerable and the people in the front line.
A couple more questions first, just to understand a little bit about vaccination per se, because I think sometimes there is the sense that the vaccine, once it appears, is kind of a magic bullet, right? Now, what would, at least for those who are able to access it and so on, when you say, for example, 60% chances, so we're assuming safety is not an issue, that safety has been accounted for. So efficacy is the next stage. 60% efficacy suggests that that everybody who gets it still has a 40% chance of contracting the disease. Is that correct?
Under certain conditions. So it could help us achieve herd immunity. So I think that's the reason why you would vaccinate. You vaccinate 300 million, then you assume that quite a few more Indians got have got the antibodies already. So with that together, we can build the herd immunity. So that's where I'm coming from. So I'm hoping that in 2 to 3 years, just as the economy recovers, we will also make sure COVID will become part of, just like dengue and chikungunya and all these things.
I think the nerve-wracking thing is to not have a sense of what those 2 to 3 years might look like. If let's work with the timeline you mentioned. Say late this year we begin to be able to actually to start administering it to the most vulnerable. We're assuming, like we said, that process goes smoothly. We're assuming that system doesn't literally crash under panic and so on from everybody wanting it. But for those of us who do not get the vaccines till end of next year and so on, what do we think our lives are going to, is social distancing something that is here to stay till everybody is vaccinated? Are masks here to stay till that happens? Or is there a stage at which some version of a new reality can kick in, of lower anxieties, of lower caution?
humans are hardwired for hope and improvisation, and to be able to manage with the times. That's how evolution actually took place. So I think that, like the Japanese, you'll all be wearing masks. We'll all be wearing masks for many years to come. With that, who knows? For the next decade, we probably wear a mask just because it becomes a behavior, mainstream behavior. I think that social distancing has given way to bubble. So who's safe, and those are the bubbles. There are very few who are living in complete isolation. So I think that these behaviors will continue to change, and I think that as there's a vaccine, and like you said, we might become crazy, and just the way that thing gets given, I hope the security of that is very, very carefully done. People will start getting a lot more confident, a lot more hope, and so the new social behavior will be cautious, but just there, that this is at the edge, but not in your room. Now you believe that it can be in your room.
Yeah.
Tomorrow you know that you have the ability to keep it outside.
I'm going to shift a little bit to a conversation on healthcare as such. I know that there will be audience questions, probably more specific still to the pandemic. But I just wanted to ask you, first, how would you read the Indian healthcare system? And right now, I mean public healthcare, government healthcare, nationally, as a result of this pandemic. What do you think are the absolutely urgent interventions that not only does the government need to make, but that citizens need to throw their collective weight behind?
So I think that Churchill said, right, never waste a good crisis. So there's always an opportunity. So by announcing the National Digital Health Mission, this is something that would never have happened. So they want to create something like a UPI, that everybody has a health number, which means that, your medical records, there's portability, and so there's some amount of digitization. The great news is that telemedicine, that has always been there. We've had it for almost 15 years, so we've done 10. But all of a sudden now, it's just become, it's people trust it now. It's actually become not really ubiquitous, but it is become mainstream. And I think that's one of the changes that has taken place, the ability to do a lot more health on mobile. People have a lot more knowledge. They know how to look after themselves. So this entire generation now has changed. And it's done that in 6 months, that we've had so much time to read and look and do things. So I think that having said that, it has helped us. We need to move away from the old metrics that people had about public health, saying India doesn't have enough doctors, India doesn't have enough healthcare facilities. Instead, we can say, by adding on this technology, how can we make one doctor way more effective? That if a doctor doesn't want to go to rural areas, he can do it from a city. From Delhi, he can service anywhere in India with using this technology. Then let us write the new metric. And that would be the interesting experiment of the new healthcare.
So I think, and there is an unspoken or unarticulated, or often just not completely thought through fear that those on the wrong side of a digital divide are going to be left out of this. It's a legitimate fear, I think, largely because even now with a high internet penetration and so on, in absolute numbers they're high. In statistical to our population, what are the chances that at the scales we need, people will have access to quite simply the basic devices, whether it's a smartphone and whether it's a good internet connection in the smallest towns, even if it's community, even if it's not at the individual level, right? What's a time frame in which you think, assuming we work to a plan, when can we say we will have a working, robust system that can tackle the sheer numbers who currently have no access?
So I think that digital technology and health will actually help bridge the divide. It won't increase the divide, because what it does is it takes it to the, geography is no longer is no longer relevant. You can get it anywhere. The government has invested in the CSCs in every village, the broadband and that network. So they're giving it free. The primary healthcare centers can now be wired. A lot of stuff can go on digitally. So care can be given at home. So I think that, we can bring down the cost of healthcare. And it can become a lot more inclusive using this health solutions this way. But having said that, we have to be able to do it at scale. The public and private sector, so there's more, all these experiments are going on. I think that India will adapt very quickly to the new reality. So I'm very hopeful that this will help healthcare really emerge, that, understand that in the US and all that, the per capita for healthcare is $10,000 per year. In India, it's hardly $100. So what can we do to keep that low, but make it, touch everybody's lives and continue to give them world-class care? And I think, that was why my dad started Apollo. And I think that this digital health will be the next leap forward for India.
So are there a few areas, for example, when you say telemedicine, but are there a few areas that you think we're going to see the most dramatic changes in the next decade for healthcare per se, even if it doesn't yet trickle down to every part of the country? Are there going to be big changes that you can anticipate as a result of this moment in even just urban healthcare?
The first thing will be point of care testing. I think that these labs might become obsolete, because as you get a point of care test for COVID, you can get it for your diabetic testing, for your lipids, for everything. Pick up something from the pharmacy, go home, test, put it onto your smartphone, and just so I think that people, and there was a McKinsey and Anderson Consulting one. There was a study done, and they said that 80% of the world's population that had access to a smartphone is now has now done something with respect to digital health. But of course, more than 70% of them weren't satisfied with the level they have now, but they've started engaging. And in India alone, 50 million teleconsults have been done in the last 6 months. So I do think that this will become ubiquitous.
And in the sense of other than, is there a risk because of the pandemic of losing sight of other really, really catastrophic health crises that have not been resolved in this country as well as in other parts of the world? For example, even just what we start to live with and manage. Diabetes is a big crisis here, or there are other killers. Is there a risk, both at the individual level, of letting fear of one disease prevent you from taking necessary action in another, as well as from the healthcare system per se? Do we risk becoming too myopic by what's in front of us?
Thank you for that question. As we opened up, I went through the participants, and I think my dad is on this. He would have been jumping. Dr. Reddy, my dad, has been talking about NCDs and how it will destroy the country if it's not looked at. So he has been the greatest advocate of saying that open up the hospitals. It is not like people are not sick. So when we first opened after the lockdown, we saw cancers that were so severe that had not been detected, and I think that India already had a shortage of hospitals, and how do you think that disease is just going to be tucked away and put for another day? Not possible. Your body is telling you that you're not well. You do need to go to safe facilities. So I think that we're just there's going to be an explosion in that also, and we're seeing it in our hospitals that people are coming in for really tough cases. Maybe I can postpone my knee surgery, but I surely can't postpone something to do with my heart. for a stent or anything to do with, just getting your diabetes in control, to so many things, cataract, all these will all come back in. So India is under pressure, and
So
we're going to see more and more.
we'll move to audience questions soon, but I again just wanted to ask, are there, we do know that there is a severe lack of enough beds. We do know there's a, say, not just for COVID, but, and as you mentioned, of doctors, there's a certain type of intervention that can be done diagnostically, maybe through telemedicine. But in the end, unless we shore up hospital beds, unless we shore up the physical infrastructure, and outside of the big cities, because we're again, I think, creating the conditions for needing people to come en masse into cities, and then cities also become the killers. What is, are there countries that you think have done this well, which is geographically sound, large-scale health facilities that diffuse the pressure? What is it that we should be focused on as a country? How many beds, in what time frame, on what kind of war footing?
So fundamentally, there is no country that you can compare India. We're many countries put together with our population. So for us to be taking some of those models, look at Kerala might be great. One district might be great, equivalent to Sweden or any of these places. So look at India with that different lens of how you cut it. The second part is, when I spoke about technology, we ourselves are redesigning our hospitals. With technology now, much of the care can take place at home. Today we have like 3,000 hospital beds for COVID, but we have another 2,500 hotels that have been converted. So I think that now with technology, we can actually, hospitals will be redesigned to take care of the very sick. And a lot of this they can go home for, they can go home faster. We can set up ICUs at homes. So think about that as an added capacity. So I think what India really needs to focus on is getting more healthcare workers. And it's a good thing to have, because people are looking for jobs. I would think that if I was the government, I would embrace us like crazy, because we can provide good paying jobs. And India can in fact provide good paying jobs for the whole world as the world grays. So I think that as a national mission, if we can say that, what can we do to create more healthcare workers, doctors, nurses, everything, paramedics.
Like I said, before moving to audience question, a final kind of question for the moment. There is a sense of, as things open up now, and I think even in, say, Delhi or Gurgaon, as of Monday now, the metro opens up. In other cities, I'm sure different stages, the same thing is happening. Bars are opening up after being closed. Is prevention a zero-sum game? And really what I mean is how would you suggest we look at trade-offs? If I want to go out, what else can, or is it simply you're just putting yourself at risk? Is there a way to approach this risk from a intelligent perspective, to be able to put yourself out there a bit more than we are at the moment, but not to feel like we have disproportionately taken risk?
I don't know the politically correct Apollo answer. I gave all that to you earlier.
Accurate.
So for me, it would be really about who it is that I need to protect. So if you're living with someone who's vulnerable, then I think, like, my daughter is very careful. She's like 29, so she's super careful. But by herself, if she lived alone, she could go anywhere. But we live with my mother-in-law. So I think that that's the kind of behavior. Be more responsible. And if it is, yes, the bars are open, you should go and in a safe way of however that you can, still practice this. I don't even know the right answer for that one. But having said that, I think that it would be irrational for us to say that, the rest of the world is doing it. We can't keep these places closed. But if you're going to be exposed and you're going to be a carrier to someone who's vulnerable, or if you yourself have comorbidities, very irresponsible to be doing things like that.
So I'll switch to taking questions. And there's Bhaswar is saying, while everyone is waiting for a vaccine, we're hearing disturbing news of the virus's resilience. European countries, the numbers are rising again. And also that infection doesn't necessarily give rise to immunity, as the antibodies created don't last forever. And those infected and cured could have it again. What then is the prognosis of this disease? And I think just to expand on that question, what is it that we really do know? And what is it that we hope? I think we often lose sight of firm knowledge versus estimations and hope. So if you could just tell us that.
We know a lot more now. We know how to treat it. And even though the drugs are repurposed, I think that most of them are effective. Doctors will treat you. Doctors will get you well. What we're seeing, I know quite a few people who have got it twice. Some of the asymptomatic that didn't develop antibodies, most of them didn't. So they are vulnerable within weeks, within months, that they could get it again. So I think that when the vaccine comes, the world will just give it, that this is a war. We're only 6 months into the war here. Give it another 1 year. This will be the time that, it just can't stay still. We will have to tackle it in a very mature way. That we do know, everybody knows this fact. So till a vaccine comes, you might get infected again, but what can you do? And tomorrow what will happen is take the vaccine every year, be careful, it'll become like the flu.
Symphony Tech, somebody under that handle wants to know what forum in India is coordinating all Indian vaccines for approval, what committee is reviewing, since today multiple departments are involved, and they go on to name DBT, ICMR, CDSCO, DOA, academics, MOH. So for manufacturing and supplies, for distribution, for monitoring effectiveness, post-vaccine monitoring, what are the bodies involved? And do you think it's a robust process in place for that?
I can't comment whether it's robust or not, but I do know that India is working with the international bodies, WHO, Gavi, which is the Vaccine Alliance, CEPI, which has created access. They've given grants, $100 million to Serum, to all the others, to be able to ramp up facilities. So that's in place, that the government is engaging with the world. It's really a pyramid. Everything goes to the PMO as I understand it. So there are players like Niti Aayog, but the chief scientific officer. But I think many of these decisions are, because it's so crucial, it is being taken right at the top. So the way, so I think that going forward also, they will use, and being coordinated from a central place is actually a good thing, because they can use the entire machinery of whatever's available in Delhi. Having said that, health is still a state subject.
Yeah. Where do you think the downsides of that lie? Is there merit in thinking of health needing to be a national subject?
I'm not the type that thinks that great power gives you great responsibility, and you'll actually act on it. I do think that we need a more, democratic. We're a democratic country, so there'll be choices that need to be made. There are different solutions that will take place. So your RWA is probably stronger than your chief minister at this point. So everybody's taken power.
Okay, Ash Sethi wants to know, in the current circumstances in urban healthcare, what's the future of healthcare at home for not just COVID, but for other ailments too? So you did allude to this. Yeah, but there's an associated question by somebody who's clearly part of the 70% who's dissatisfied with telemedicine or with video consults, because she says, I have a cough for 4 months. I had 6 video consults, and I think it was not the same as a physical checkup. Would have recovered by now. Test was COVID negative. I think the question there really is to say, obviously her assessment is that a physical diagnosis might have come in much fewer consults than the video consult. In your experience, is that true? And what can we do to minimize that?
I heard, like the US, I was on my World Economic Forum panel that had the US healthcare providers, and they said also that a lot of that, while that immediate rush for that steep rise in teleconsults, now as hospitals open up and more facilities, the doctors are available there. So I don't think that it's an either or. I think it's an and. That definitely the physical till for the longest time. But what happens in the middle of the night if you're sick and you need help, or you're in a different time zone? So it's always good to have, So I think that this will augment the resources of medicine. It will not solve every problem. So please go see your doctor. Come to Apollo. We made sure that there's no COVID.
I think Hebziba Rajendran wants to know, how do you feel about antibody testing, and how reliant would you say we should be on the presence of antibodies? Is that a shortcut that is worth expanding its scale?
Not now. I think that people that have had it, it's always good to know. So if you've had COVID, please take the antibody test. And find out if you've got it. You need to wait a month or two before it really kicks in, and so it will become mainstream. It will become part of the mainstream, but it's not the solution.
Sure. There's a couple of questions about mutation. Saeed Qasim wants to know, what about mutation of the virus? The vaccine won't help then. And Bhaspar wants to know, if the mutation is so rapid, again, would the vaccine continue to be in a state of trial and error? So do you anticipate that there may not be a stable vaccine for some years to come?
Hey, I'm a doctor of economics. I'm not of medicine. So I will tell you what I've heard secondhand from our doctors. So don't kill me if I'm this thing, but I think that this you were asking about, sorry, I lost track of that.
Yeah, mutations and
mutations. So in the mutations, sorry, that I think that there is certain the strands, as they change, there's a certain amount of this COVID-19 that is actually unique and that will stay without mutating, and that's why it's called this. So what these people are looking at in the vaccine is to be able to manage and take care of these. So I would think that it's a very safe bet that tomorrow this thing, if it mutates out of this range, it'll be a different pandemic that we have. But right now, for COVID-19, whatever is being done, the DNA, RNA has been sequenced, and we can be sure that it will work. It's just like Ebola and all these others that are in the same family, not the exact, but each one will.
And I think Adar Poonawala a little while ago said that in his understanding, obviously serum is manufacturing those doses, that this is almost certain to be a two-step vaccine, which is a booster dose after an initial dose. Is that your understanding of where, and what would that mean for, if you've had one shot, does it mean you're not fairly protected? Would you just talk us through a little bit of the mechanics of that? What does it mean to need a two-step vaccine or maybe a booster vaccine?
So the Jnj vaccine is a single dose, and it doesn't need cold chain. So everybody's got a different approach to it. So the one that Adar is talking about is the AstraZeneca, and it is just like the MMR vaccine or anything that you take when you were a child. After a few years, you did need to take a booster. So if they're giving us that, we've still not understood yet what it will be, because different vaccines will do different things. Is it an annual, like you take your annual flu shot, and then there's no question of a booster. It's just an annual thing. But is it that we can get one shot and a booster 4 or 5 years later. So there'll be many different things as they evolve.
Kavita Reddy is asking, she says the global pandemic has shown us the inadequacies, of course, of our healthcare system. And one of them, as you mentioned, being of healthcare workers. Pursuing medicine as a profession right now is the most expensive career. It's simply out of reach of many people. The complacency and increased revenue in the middle class generation have lost interest in life-saving careers. What do you suggest we do to increase interest and accessibility of these careers? And I would say in the context of the pandemic, how do we make people want to put themselves at risk, as we have seen, at times when everybody else wants to be safe?
You'd be surprised that people take up medicine because, you know, we're so privileged to be able to be given the responsibility to help another. So the people that are there, there's not a single one. Nurses from Kerala, their parents called them back and they said, no, we became nurses to serve. And I just went through the statistics. I got the recent statistics. We have 70,000 people in Apollo. So about 3% of them have been infected with COVID. But no one, turned around and said, this is not something we want to do. So they present themselves in the front line. It's almost like a soldier. There's nothing different. And when you talk about costs, I think that what there were private colleges that were taking these extra fees and everything, but actually all that has gone away now. There's a certain price that you have to pay. And let me tell you that we have 2 medical colleges and we, hand over heart, we don't make money. We actually have to keep investing in the hospitals and all that. But what happens is we're doing it because we know that we'll get a better class of doctors coming out. So and the government, when they do it, the whole fees is like it's less than getting it's less than getting an MBA from IIM with this or from ISB. The fees every year. It takes you a little longer for sure, and if you want to specialize, it costs you more. But that is the cost that it requires, the investment it requires for people to actually train a doctor. If it was that easy, then, medicine, people wouldn't need. But, would you really trust yourself to go under anesthesia and have this surgery unless you had someone who was brilliantly trained? So I think that there are always 2 sides to the coin. And while I think that it is super expensive, on the other side, from my point of view, I think it's a privilege and it's something that we have to create more facilities for, but it's expensive.
Sure. We have just a couple more questions we have time for, and I'll just take those. Shivam Kaushik wants to know, do hospitals have established operational guidelines to tackle spread of hospital-acquired infections? What have been the challenges to implement these measures, such as quarantine floors, use of mask sanitizers to keep the treatment of other diseases open during the pandemic in India and overseas?
So the only thing I can tell you is that in our hospital, the people who work in the COVID ward have not got infected. So I think that we're doing a pretty good job. And one of the things that's really important, apart from the discipline and the expense of PPEs, it's also the air conditioning system. So you have to make sure that it's completely separated, which is why when someone told us, please convert all your beds into COVID, you can't. It's physically not possible. You have to be able to look at the engineering and how the physical space and also the personnel. So,
an anonymous attendee who's not given their name wants to know what are the aftermath effects that you are seeing in COVID positive patients, issues other than respiratory issues, any long-term effects, though I imagine it's too early to think of long-term, but I think the question comes from even in this length of time, are there reports of other linked or affiliated problems that come up post-recovery?
Please don't let that be my last question because it's a really sad one.
I'll give somebody else as another.
This COVID is not a happy solution. it throws up clots. We've looked at, menstrual issues. We've seen strokes. We've seen enlarged hearts, kidneys, spleen. We're still not able to figure it out. The only thing I can say is, even if you've had COVID asymptomatically, please have a checkup and make sure that for the next year you look after your health, because we really don't know what's going on in there and how it's affected it. It's a very insidious disease. I mean, we've never seen anything. The medical profession has never seen anything like this in their entire, lifetime.
That, you're right, is absolutely not a question on which to leave this, so we won't. Kovela Nelakudi wants to know, what are your thoughts on pricing strategy of the vaccine? Could that be affordable by a common man? I think again, the question also leading from there, do you anticipate these being state administered vaccines, or are they going to be vaccines that the private individual has to sign up for and buy?
So fortunately, because of the COVAX, this is the international alliance, we've got enough money to fund the manufacturers. So today the vaccines, what I heard from, a month ago, they said it will be priced at $1,000. Today they're saying that it will be priced at $2.50. So I think it's quite affordable to be able to spend, like 250, 300 rupees for a vaccine is 100% affordable by now. Whether it will be state, I'm sure the state will have a hand in the way that it goes through. Otherwise, there'll be chaos with this. But the pricing, actually the world, we should be thankful to many big donors in the world that have been able to create this, to be able to come out at this kind of pricing. So I think it should be maybe about 500 rupees or between 500 and 1,000 rupees.
And as a closing question, what do you think has really, from all reports, even if it's not entirely clear yet how efficacious the vaccine will be, number one, all reports suggest that the top 2 or 3 have all passed a fair number of safety tests, and efficacy also to some degree is assured. We don't yet know the degree. Given that we are told that it takes decades sometimes, certainly a matter of years, to come to creating these vaccines, what has changed? I think some skepticism around the vaccine comes from the very crunched timeline. What has changed to allow this, other than, of course, the global, the cooperation? What has allowed us to put something that takes years out in a matter of months, and can it be trusted?
So it took 30 days to sequence the virus, and this DNA sequencing would have taken years before. So the computing power, the power of artificial intelligence, and many scientists working together would definitely have accelerated the time. And then the next thing is that the government is not blocking it, because we're in such a dire. Otherwise, they would say FDA, this thing, 6 months. This is all being fast tracked. So just think that this is the most efficient. If light had to travel without being blocked, that's how the vaccine development has been. About safety, I would think that there are enough lawyers out there who would be just waiting, for this public interest and these kind of litigations. So no one is going to sacrifice their business to put out something that will later create trouble. We're in a very informed and engaged world. So believe me, if the vaccine comes out, I'll put my hand up to take it.
The absolute final question: how much damage has Donald Trump caused the world in this pandemic? The sheer irresponsibility of America, led by a president like that. And is there a lesson about leadership in these? What should we be thinking of when electing leaders? Not necessarily from the populist point of view, not necessarily from an everyday policy point of view, but quite simply, is crisis management a way to look at electing world leaders?
Why are you asking me about leadership? You know, the only thing I can say is I think that leadership matters at this time because today's scars are tomorrow's stripes. I don't think leaders that have not led responsibly will earn those stripes. History will not be kind to them.
Fair enough. I think that's pretty much all the time we've taken. Thank you so much for being here. Thank you for your candor. Thank you for even the lack of optimism in some cases, but for necessary and accurate information. And all the best to everybody at Apollo. Thank you so much for being here.